I think it was having people from different disciplines being involved in the conversation, from people who are involved in delivering healthcare to former politicians, as well as people from think tanks. It was just a great confluence of ideas, I think, that we need to change the system, that the system isn't working for a whole variety of reasons right now. And people had a variety of perspectives, but I think fundamentally we came to the conclusion that it's not radical reform in terms of blowing up the system and starting all over again, but there are a series of changes that we need to make, probably starting with a fundamental attitudinal adjustment about the way policy and decisions are made in healthcare. Well, I think it has to start with government, because government does have the primary responsibility for planning and delivering healthcare. And so I think the tone needs to be set at the top, and that there are a lot of things that government can do to bring all of the other stakeholders into play and bringing them into the conversation. So I think the government has to have a vision and a plan to achieve the vision that is informed by all of the stakeholders, all of the healthcare professionals involved in the system, but also involving patients and families. And I think that piece has been missing until now, although it's becoming part of the conversation with things like the Patients First legislation that is now in committee. But I think people are gradually understanding that the patient's voice is essential at the table.